Thank you, Susan, for your leadership. Good afternoon, everyone. This is a beautiful afternoon, but we have to recognize a reality. We have essentially what is a new virus at our throats, a new virus that is twice as transmittable and is causing an explosion of this dread disease in the state of Washington. We're in the middle of an explosive threat to our freedoms because of this disease. We want the freedom of not having to shut down our economy again. We want the freedom of not having to wear masks sometime in the future. We want freedom of our children not having to worry about getting this disease. And we want freedom for everyone to live without even to think about the COVID virus. And we know that there is only one path to that freedom, and that is through more Washingtonians getting this safe, effective, successful vaccine. Therefore, today, the state of Washington is taking decisive action against this COVID disease. We do so to protect our vulnerable communities, to prevent further calamity to our state, and to once again be on the path to full recovery for the state of Washington. So we will be requiring our state workers and our contractors who come onto our sites and workers in private health care and long-term care settings to be vaccinated as a condition of further employment. Individuals covered by this order I will issue today will have until October 18th to become fully vaccinated against the COVID disease. Now that means you essentially have to have your last vaccination by October 4th, depending on which particular vaccine you take. And as we know, you have to take 2 doses of the Moderna and Pfizer product. So October 18th will be the date we will expect all of our state employees and folks in healthcare settings to become fully vaccinated and therefore save lives in the state of Washington. This will be a condition of further employment in the state of Washington. Now we know it's the mission of public servants, people I'm very proud of. You look at the people who work for the state of Washington, they've been doing some great work recently, certainly in the Department of Health, to try to fight this disease. I've seen up close and personal how hard they're working. These workers live in every community in our state. They work together every day in public service. They are people who went into their profession because they care about their communities. And we know that they believe that they have a duty, as we all do, to protect our fellow citizens from this virus. And those fellow citizens have a right to be protected. They have a right to not be infected by those who are not vaccinated. So we know we're experiencing a severe increase in the disease because of the Delta variant. Cases and hospitalizations are spiking. Just a week or two ago, they doubled in only 1 week, and they're heading upward. Since the first wave, this is the highest R naught number that we have had. And we know that the overwhelming majority, something like 95% of recent hospitalizations, are for people who've not been vaccinated. Today, this is a disease of those who have not been vaccinated. And we have to recognize this reality. The reason we are in this pickle today is because about 30% of our eligible citizens so far have chosen not to get this life-saving vaccine. But we know it's never too late to make the right choice, and we're confident that people will. The large majority of Washingtonians have already done the right thing to get vaccinated, and we simply need more people to roll up their sleeves, literally, and help pull on this rope. You know, it's understandable, I think, that some have been hesitant up till now. It's understandable they would ask questions about this vaccine. It's a new vaccine, by the way. But now we have had over 300 million people take this vaccine safely. Over 165 million Americans are already successfully vaccinated. This vaccine has now been armed for over a year, safely and effectively. So we need folks to protect everyone, including our children. Children under 12 can't get this vaccine, and they are potential victims of being transmitted this disease by those folks who are not vaccinated. We know these things work, and we know it's a key to ending this pandemic. I want to thank Kaiser Permanente for hosting us. They've shown leadership. I appreciate this hospital. They operated on my foot, and it worked really well back in the mid-'60s. I also want to thank Bob Ferguson, who was the first public official in Washington who essentially advanced this step for the people who work in his shop. And I certainly encourage all local governments and higher education and legislature, other elected officials, and others in the private sector to join us. Because without this, folks are going to continue to be breeding grounds for further mutations, potentially, of this virus. This could get worse, if we don't get more people vaccinated. Now, our policy in my executive order will provide for limited exemptions from the vaccine requirement that citizens can apply for. These are not automatic exemptions. Applications will be considered. Someone with legitimate medical reasons or sincerely held religious beliefs for not getting the vaccine can make applications. These exemptions do not include personal or philosophical objections. Now again, the idea here is to keep everybody safe, because we are past the point of thinking we can test our way to safety here. Tests are helpful, but what we have learned in the state of Washington is that they don't solve the problem. I'll give you an example. We have had a testing requirement now of, I believe, once a week for our folks who work in our Department of Corrections department. But in the last month, we've lost 2 deaths of people in our Department of Corrections who had been tested. We simply cannot lose more people who work for us in the state of Washington. These are dedicated people. They deserve our protection, and we owe them their families' protection as well. We think this is a prudent decision for that reason. Now, I want to say that I respect diversity of opinion about this. I know there is diversity of opinion about this. And I understand there's rational discussions that have taken place, but we need some more rational discussions. And I hope that folks will continue to talk to their coworkers and their families and their neighbors about this. Encourage them to talk to their physician. They'll tell you when you have over 300 million doses given safely, it's the right time that we move forward together as a state. And we know that disinformation has been a problem, and the answer to disinformation is the truth. And all of us are sharing a truth today. When we vaccinate state employees, we protect citizens that they serve. When we vaccinate state employees, we protect state employees. And when we vaccinate state employees, we reduce the threat that we have to take other measures in the future because of this dread disease.